So what do you mean by severe sepsis? If the patient is having sepsis and organ dysfunction along with hypoperfusion or hypotension, we're going to call it as severe sepsis. Examples of severe sepsis can be lactic acidosis, oliguria, AKI, altered mental status. All of them are signs of hypoperfusion, right? So what do you mean by the term septic shock? It's severe sepsis. It's severe sepsis plus if the patient does not respond to fluid resuscitation. We have initially tried resuscitating with fluids of at least 30 ml per kilogram, but if the patient does not respond to fluids, that is what we refer to as septic shock. So let me tell you the definition. Sepsis with persistent hypotension requiring vasopressors to maintain MAP of more than 65, plus if the patient is having serum lactate of more than 2, which is a definitive sign of hypoperfusion, despite volume resuscitation, at least 30 ml per kilogram, right? So that is what we refer to as septic shock. So it's fluid refractory hypotension or failed fluid resuscitation. That's what we refer to as septic shock. So what is the common cause of septic shock? It's going to be because of gram-negative rods. Most of the time, it's going to be gram-negative rods. Gram-positive cocci rarely produce septic shock. Usually, they don't produce. Endotoxic shock, that is gram-negative shock, is the commonest cause. It can be due to pneumonia, UTIs, bloodstream infections like central and associated bloodstream infections, intra-abdominal infections, and so on. Sometimes non-infectious mimics can produce septic shock-like presentation like IBD, especially if it's toxic intubation or MI, pancreatitis, pulmonary embolism, DK, SLE. These things sometimes can mimic a severe sepsis or septic shock, but in most situations, it's going to be quite simple and straightforward.